Good evening friends, my name is Nikita Phodi and we are going to cover today the ADR topic. In that ADR topic we are going to cover the definition of ADR, the types of ADR and the special scenarios of the particular ADRs. Firstly, we see the definition of ADR, which is the appreciable or harmful or unpleasant reaction resulting from an invention related to the use of medicinal product. In a simple language, that unpleasant and unwanted reaction of that particular drug except their therapeutic effect is also known as the ADR, means adverse drug reaction. According to WHO, the definition of ADR is as the response to the drug that is noxious, unintended, and which occurs due to disease normally used in a man for appropriate diagnosis, therapy of a disease for the modification and a physiological function. That definition of ADR is according to WHO. After that, we are going to see the types of ADR. There are main 6 types of the ADR. First one is a dose related, non-dose related, dose and time related, withdrawal of dose, and unexpected failure of therapy. These are main 6 types of ADRs. We are going to see them one by one. First one is a dose related, that is also known as an augmenter. This can include adverse effect at either normal dose or an overdose. And this may include the extension of a therapeutic effect of a particular drug. After that, second type is a non-dose related. This refers to a drug effect which are totally unrelated to the dose. Means that in that type, the ADR is not related to the dose effect. Means that the quantity of that particular drug doesn't matter for the occurring of ADR. After that, time related reaction, that refers the drug effect which occurs due to the prolonged use in a drug which doesn't tend to accumulation. Means there is no need of that particular drug is to carry for the long time or administration for the long time. If we administer that particular drug for a long time, then the ADRs are occurs. After that, dose and time related reaction. This refers to drug effect which occurs due to the dose accumulation or with the prolonged use. After that, withdrawal of reaction. This refers to undesired effect of a causing drug. And last but not the least, unexpected failure of a therapy. This category has been added to describe an undesirable reaction of a drug efficacy. After that, these are the 6 main types of ADRs. After that, we are going to see the special scenarios of pharmacovigilance. In that, there are total 14 special scenarios which we are going to see. That the first scenario is the incorrect dose administration. In that, the administration of drug except the prescribed drug is known as the incorrect dose of administration. After that, incorrect administration of duration, means some drug has a morning time or afternoon time or evening time. We should take that drug we should take that particular drug at the particular time to get their right and effective therapeutic effect. After that, wrong technique in a drug usage process, means while we administer that drug, our pharmacist or our physician explain us how to administer that drug. We should administer that drug with water, with alcohol, or with milk, or to administer that drug usually. That means that affect the therapeutic effect of that particular drug. It means the route of administration, means the route of administration, technique of administering that particular drug also affect that therapeutic effect of that particular drug. After that, wrong patient receives wrong medication. In that, the it occurs by usually occurs by nurse or ward boys, because because of rush and because of hurry, they give the medication, wrong medication, to the wrong patient. Due to that, the ADSR occurs. After that, the drug dispensed to a wrong patient. It's totally by the mistake of pharmacist. It means that he dispensed that particular drug to the wrong patient. Means he take that prescription and describe other drugs to the patient. It's for, and due to that, the patient occurs the ADS. And after that, the wrong route of administration of drug. Wrong route of administration of drug. Usually the patient neglects that guidelines to administer that drug given by the physician or the maid or the pharmacist. It's occurred by the patient or the relatives of the patient. After that, the drug misuse means if we take the sleeping pill to fall asleep, and if sometimes we did not get a sleep, we take that pill, another pill, after an hour to get the similar effect. That criteria means the misuse of a particular drug. After that, drug overdose means the pharmacist or the physician give a certain amount of dose to administer that particular drug. Except that we consume that particular double or thrice of that particular drug is also known as a overdose of a drug. After that, drug administered in a patient to appropriate age means some special drug has a restrictions to the age limit. Means some drugs are only prescribed for the babies, or some drugs are specially prescribed for the adults. Means the pills, serums, and capsules, tablets are specially prescribed for the adults, and the liquid cup syrups and the liquid medication is also prescribed for the childs. Is for child. After that, the expired product used. In that wrong drug patient appropriate age, the example of cholesterol means the cholesterol pills and the asthmatic pills are only prescribed for adults. If we prescribe that for the babies or the below underage age patients, they may occur ADS. After that, expired product use means the expiry date of product is passed and then we administer that particular drug. After that, the drug shows the not showing the therapeutic effect, it shows the adverse drug reactions. After that, drug exposure during pregnancy means some drugs are restricted in restricted for the pregnant women. Examples as ibuprofen, naproxen. These drugs are restricted for the pregnant woman because after the consumption or administration of that drug, they directly affect that baby or infant which is present in the stomach of pregnant woman, or they after the birth, many side effects of that particular drug are occurs in a baby or infant. After that, drug abuse. Drug abuse is a consumption of excess drug. Means till consumption of particular drug till it affect our physical and psychotic health. If we consume a particular drug over the limit and it directly affects our physical and psychotic health, is known as a drug abuse. For example, the lipoids, including heroines, these are the drugs which affect which excess consumption of that particular drug directly affects our physical and our psychotic health. And the last one is incorrect product storage. Means every drug has a special direction to storage that particular drug. Means insulin should have to store below temperature. Means it should store in a refrigerator. Some medicines store in an amber color bottle to do not exposure to the sunlight or sunlight. That means every tablet and every medicine has their special storage condition. If the pharmacist do not follow that the condition or the regulation to store that particular drug, the drug exposes and it shows the effect except the therapeutic effect, means the adverse reaction, and it may be dangerous to the patients. That's it. These are the 14 special scenarios of ADRs. So in that whole video we show the types of ADR, the definition of ADR, what is the ADR, full form of ADR, and after that the special scenarios of ADRs. That's it. Thank you.